Conspiracy theories often have an element of fear to them. A shining example is the chemtrail conspiracy theory.
Chemtrails are definitely real. For those of you out there that are not familiar with what chemtrails are, they're those cloud-like lines that you see in the sky, and they look very similar to contrails. Researchers have found out that the main ingredient in these chemtrails is this substance called barium. Now what barium is a soft metallic water-soluble agent, and it's very toxic. So why would the government allow these different corporations to pollute the North American airways with this nonsense that can cause all of these disorders and quite possibly be able to produce cancerous agents in you and myself? The reason is because the elite of this world are united in a concerted effort to destroy the masses and to do what Henry Kissinger once said, get rid of the useless eaters. And in case you're wondering, that's right, he was talking about you.
Adding these elements of fear really helped to make the conspiracy theories much more interesting, even if it's at the expense of truth. And Dr. Day's videos are full of this kind of fear-mongering.
Chemotherapy is poison, pure and simple. It does its work by poisoning the cancer cells. The problem is that it also poisons the normal cells. The doctor's hope is that since the cancer cells are multiplying faster than the normal cells, that the poisonous chemotherapy will destroy more cancer cells than normal cells, since the chemo is most effective against cells that are multiplying rapidly, the cancer cells. But the chemotherapy often kills so many normal cells that the patient either dies rapidly after the first round of chemotherapy treatments, or the chemotherapy does so much damage to the other organ systems that their body starts slowly deteriorating until all or nearly all systems fail and life is unsustainable and the patient dies.
If that isn't a scare tactic, I don't know what is. I found it difficult to determine what the death rates actually are, as natural healing nuts have successfully flooded the internet with all kinds of lies regarding survival rates, with claims of up to 80% of patients dying from chemotherapy. Obviously, chemotherapy wouldn't be used if 80% of people died from it. The only article I could find giving the percentage of deaths found that 0.8% of patients died from chemotherapy, and a medical textbook had written that between 0.2 and 0.9% of deaths resulted from chemotherapy. Obviously, this is far from 80% and far from often. Dr. Day's claims are simply in direct contradiction to the evidence.
A person cannot develop cancer, or any other disease for that matter, if they have a healthy, properly functioning immune system. So when a patient has cancer, by definition their immune system is already suppressed. It's not working properly. But chemotherapy and radiation destroy what's left of the person's immune system. The only system in your body that can get you well and keep you well. The very system you must have in order to get well.
I was unable to find any evidence that radiation has a significant effect on the immune system, but of course chemotherapy does have a negative effect on the immune system in general. That said, this may have been unknown at the time she made the video, but there has been research which actually shows a positive effect of both radiation and chemotherapy on the immune system. Chemotherapy and radiation actually causes an immune response to the cancer. So think about this. Her claim is that the immune system will get you well. So by her own standard, chemotherapy and radiation must be beneficial. Again, her statements are a direct contradiction to the scientific evidence. She goes on to claim that chemotherapy and radiation harm the body by listing every possible side effect. But even Dr. Day's dose of sunlight in her treatment plan has a small chance of causing cancer, heat stroke, dehydration, heat exhaustion, water intoxication, and even death. You can't just look at the side effects and say that you should hide from the sun just because it might give you a side effect. What she's not telling you is what the chances of these effects are versus the benefits. And that's what really counts. If you're going to die from cancer if you don't have these treatments, then it might just be worth suffering through some side effects to prolong your life. Let's look at one last argument.
Let me offer you a proposition. If you have a young son or a daughter who's perfectly healthy, how about if I offer to pay for 6 months of radiation and 6 months of chemotherapy for them? It won't cost you a thing. Would you let me do it? Of course not. Why? Because it would make your child terribly sick and maybe even kill them. But think about it. If you won't let me do that to them when they're well, why would you let me or any other doctor do it to them when they're sick? It doesn't make sense.
Let me offer you a proposition. Suppose you have a young son or daughter who's perfectly healthy. How about if I offer to pay for surgery for your daughter or son? You don't have to pay anything. You wouldn't do it. Then why would you do it when they have a broken arm, for example? People don't get broken arms because of a deficiency of surgery. So obviously you shouldn't have surgery when you have a broken arm. Do you see how stupid this argument is? People have surgery and chemotherapy because there's a chance that it will fix the problem. Is that really so hard for you, a medical doctor, to understand, or are you just purposely conning dying and sick people out of their earned money without any consideration of how it will shorten their lifespan? So to sum up, I have shown that she has no evidence that her 10-step plan works. There's no conspiracy theory to keep scientists from researching the effects of diet and lifestyle. And her fear-mongering about cancer treatment is simply in contradiction to the scientific evidence. Thanks for watching.